Could you tell us a bit about your role in the NCCN at present?
Yeah, and just in case some of your listeners are not as familiar with NCCN, we are a global nonprofit organization of 33 member institutions. These are large academic comprehensive cancer centers in the US, and our mission is to define and advance quality, effective, accessible cancer care and prevention. And while we have a number of great programs and great resources, I think what we're most known for is the development of NCCN clinical practice guidelines in oncology. We currently have a library of 88 different
Mhm.
guidelines. These cover about 95% of all incidences of cancer worldwide, and they are represented in an algorithmic approach. And so it really helps clinicians and other practitioners follow the treatment pathway for their patients. They cover the continuum of care, so all the way from screening to survivorship. So why are guidelines important? So we know a large body of literature looks at the importance of guidelines in practice, and this is not just NCCN guidelines. A number of great organizations create guidelines, ASCO, ESMO, national guidelines. And the research shows that first, guidelines standardize care. So you avoid undertreatment, you avoid overtreatment, and you really ensure patients are getting the latest and brightest access to evidence-based standards. They also help oncologists and practitioners really guide the care for their patients depending on the stage and the type of cancer. A large body of research looks at outcomes. So following guidelines, concordance to guidelines improves a number of different health outcomes, overall survival, less toxicities, quality of life, things like that. And I think the final point is that they help inform policy and reimbursement. So, for example, in the US, NCCN guidelines are used for coverage determination in both our public and private setting. So that's an overview of guidelines and NCCN, but my role is kind of the global program. So just to
Yeah.
give you some background, and it helps explain why we have a global program. We have about 2 million registered users to our website. Half of
Wow.
those users, 1 million, are located outside the US. And we had about 16 million guidelines that were downloaded last year. 8
Wow.
million, or half of those, went outside the US. So as an organization, it's really important that we make sure that practitioners and oncologists all over the world can access our content. But we also think about ways we can make the guidelines more relevant for local contexts. So while a large majority of recommendations in our guidelines can be applied universally throughout the world, we understand that there differences based on the local context, the local healthcare system, and the resources available. So we have a process where we partner with in-country groups and experts and systematically go through the NCCN guidelines and identify where modifications need to be made. This might be based on what clinical research looks like in that country or region. There might be metabolic differences. There might be
Mhm.
differences in coverage and resource availability. So those are then incorporated into the guidelines, and we call these international adaptations of the guidelines. I want to emphasize this is a very bi-directional process. So often our guidelines will incorporate recommendations made by our international colleagues, and it really helps strengthen both of our cancer care systems, and really emphasizes this learning across borders. We have programs in this area for Asia, Latin America, Europe, and the Middle East.